Early childhood caries, or more simply known as tooth decay in young children, is a potentially infectious disease. Project Toothkeeper found that parents are largely unaware that they can easily pass cavity-causing oral bacteria to their children through sharing food and utensils. We dig deeper into this.
Yeah, occasionally. I think we do. Yeah,
Okay.
especially when we're outside. I don't think so much, obviously, when I'm sharing, but yeah, I guess it will happen.
Help them to chew on food that's good for their gums.
Yeah, sometimes we should. I think if both of us has a good oral hygiene, it should be fine. Is there any problem?
We speak to Paediatric dentist Dr.Catherine Hong to find out more.
Most people think that dental decay or dental caries is a disease caused by eating too much candy, too much sweets, and so on and so forth. But and some of that is true. It's just that dental decay is also a disease caused by bacteria, mostly Streptococcus mutans. As such, the bacteria can actually be transmitted from person to person. Parent to child is obviously the big one over there. People used to believe that the bacteria can only stick onto hard tissue like teeth, but in more recent reports, people are saying that the bacteria can also attach to oral tissue and oral mucosa, so as early as less than 6 months, maybe 3-4 months. As such, parents should really not share their utensils or share like towels or toothbrushes with their child, because they can transmit the bacteria from their own mouth to the child's mouth. And more so if they know they have dental decay or these bad bacteria in the mouth. If they can do that, then the child will not get the bacteria as early, and they may acquire it later on in life, but they won't get it as early, and as such their risk of dental decay will probably go down, and caries risk will obviously be lower. In general, adults have a more complex microflora than children. When children are first born, usually their mouth is quite clean. The bacteria in their mouth is quite not very complicated. So as an adult, right, no matter how clean your teeth is, no matter how good your oral hygiene is, you will have a more complex bacterial structure than your child. And therefore, in general, you don't want to pass, you have the good and the bad, but you don't want to pass the bad one to your child. So I wouldn't, and it's not hygienic too as well. And saliva carries a lot of germs, a lot of bacteria and other yucky stuff in the mouth that, we don't want to pass it over from one to the other. Therefore, even if you think that your oral hygiene is very good, you have no decay, I still wouldn't share utensils, because saliva contains a lot of other things other than the bad bacteria for decay. It sometimes will contain bacteria that's bad for the gums too as well. So across the board, I wouldn't do it anyway. And in addition, even if you think you don't have decay, that may not always be true because usually decay that are small is not painful and sometimes not noticeable by yourself.